My name is Naushad Shaik. I'm a cardiac electrophysiologist. I've been in practice here in Orlando for 6 years. In a field like cardiac electrophysiology, where things can get very complicated for the patients with the type of conditions, my primary goal first is for the patient to understand what their underlying condition is. I'm very passionate about making sure that my patients understand every option that they have available, and then subsequently explain to them and provide them with as much information as I can about that patient's condition. I think it is very important for the patients to understand what kind of problem or disease that they have before they can make an educated response to what kind of treatment they want. I think once that is done, it becomes very easy for the patient to make that choice, whether be it a pacemaker, a defibrillator, a congestive heart failure, or even having an ablation done. I think it's crucially important for them to understand the problem that they have first. As far as therapy goes, it is very important for me that the patient is actually involved in this decision from day one. For example, if the patient has congestive heart failure with a cardiomyopathy, I think providing as much information you can about congestive heart failure, and then why is the cardiomyopathy there? What is the risk of sudden cardiac death, and explain to the patient as to what are the treatment options. Sometimes I will tell them you don't need this procedure or a defibrillator or a pacemaker because you have not done some of the basic things that can be done. If a simple intervention can improve that scenario, and then we've done that patient a very big deal. On the other hand, if a patient has congestive heart failure, needs a biventricular ICD or a defibrillator for prevention of sudden cardiac death, arming that patient with information about this procedure makes them more accepting to this fact, and they adapt very quickly to the recommendations.